How to identify performance anxiety. Performance anxiety is a common and treatable problem that many people experience. No matter what performance you do, the anxiety you experience may be debilitating and stressful. If you are unsure if you have performance anxiety, there are common symptoms that you can recognize in order to identify performance anxiety. Method 1: Recognizing the physical symptoms. 1. Determine if your pulse is elevated. When you are anxious about a performance, your pulse will become elevated. This is your body's response to the stress and worry of your impending performance. You may hear your heat pounding in your ears if you are anxious enough. This may also cause you to blush or your body temperature to rise. Elevated pulse is related to the increase of adrenaline that is released in your body when you get nervous. 2. Notice a change in breathing. When you have performance anxiety, you will likely breathe heavier than normal. This goes hand in hand with an elevated pulse, since your body is working harder due to the extra blood pumping through your body. This may make your chest feel tight or you to feel lightheaded. Make sure you try to control your breathing to prevent this from happening. 3. Look for dry mouth. Another common symptom of performance anxiety is dry mouth. This will cause your whole mouth to become void of moisture, which may also make your throat feel tight or dry. This can also make your voice crack, which may make you more nervous, especially if you have to speak, sing, or act. Try drinking some water or other refreshing beverage to help alleviate the dryness. 4. Recognize sweaty, cold hands. When you are nervous about your performance, you will likely have sweaty hands. They may also feel cold to the touch, making them feel clammy. This may be uncomfortable and cause you to worry about how you will seem to others, especially if you have to interact with others while you are performing. Try putting some powder or other drying substance on your hand to help prevent the extra sweat. 5. Look for trembling. When you are nervous about a performance, you may have a physical response in the form of trembling. This can affect your knees, lips, hands, and voice. These changes may be bad enough for others to notice. This obviousness can make you even more nervous about your performance, especially since you are likely worried about what others will think. 6. Notice nausea or upset stomach. Another common manifestation of performance anxiety is an upset stomach. You may also have nausea as well. This is because you are so stressed and upset about how your performance will go. If your performance anxiety is really bad, you may be sick enough to vomit. 7. Look for sexual performance symptoms. Another common form of performance anxiety is sexual performance anxiety. This type of performance anxiety stems from social pressure to perform well sexually, live up to societal expectations of physical prowess, and perform to a certain sexual standard. The main symptoms of sexual performance anxiety, in addition to those of normal performance anxiety, are impotence in males, vaginal dryness in females, premature ejaculation in men, inability to orgasm in both genders. Method 2: Recognizing psychological symptoms. 1. Notice extreme self-consciousness. One of the main psychological responses to performance anxiety is feeling extreme self-consciousness. This is due to a fear of being judged by those who are watching you perform. You may also worry that everyone is watching every move you making and listening to every word while you perform. This may be even worse depending on if the people watching you are those you know or don't know. People have various actions depending on if their performance anxiety is based on fear of peer judgment or a stranger's judgment. 2. Determine if you fear failure. Another psychological fear related to performance anxiety is the fear of failure. You will start to worry because you think you are going to fail on stage and everyone will see it. Over time, this may make you second-guess your performance, analyze everything you do, and obsess over how you perform. 3. Look for increased worry. Another psychological symptom of performance anxiety is increased worry about your performance. This may be on the day that you are scheduled to perform, but it also may extend to days or weeks before your performance. This may not be worry about your performance alone. You may also worry about how others will take your performance or worried that you will humiliate or embarrass yourself. Method 3: Diagnosing performance anxiety. 1. Determine which kind of performance anxiety you have. There are two common forms of performance anxiety. One is anxiety of performing in front of people, such as public speaking, stage acting, singing, playing music, or other forms of public performance. The other is sexual performance anxiety, which is anxiety relating to sexual performance and physical prowess. These two kinds of performance anxiety are based on your personal social perceptions of how you should act in either situation. 2. Talk to your doctor. If you recognize numerous signs of performance anxiety, you may want to talk to your doctor. If you notice that the anxiety is starting to inhibit your activities or your anxiety is starting to have a negative effect on your performances, then you should definitely talk to your doctor. You will be able to work with your doctor to come up with the best treatment options for you and your anxiety. This is typically a combination of lifestyle changes, performance preparation techniques, and therapy. Your doctor can also help you treat sexual performance issues. Sometimes your doctor may also prescribe medicine to help. For example, beta blockers are often used to help with performance anxiety because it helps reduce the production of adrenaline, which contributes to anxiety. 3. Recognize the signs of a severe anxiety disorder. If your performance anxiety starts to bridge over into other aspects of your life, you may have an underlying, more severe anxiety disorder. If you have a more severe form of an anxiety disorder, you will be anxious in your everyday life and it will affect all parts of your day, not just your performances. Common symptoms include trouble sleeping, feelings of impending doom, inability to relax, feeling edgy or jumpy, constant worrying, and other physical and mental symptoms. If your doctor diagnoses this, you will work to come up with a treatment plan and find a therapist.